only one side would be able to do just fine and really not need any intervention for many, many years. Babies that have it on both sides usually have to have an operation. And the reason is that they are not equipped to breathe through their mouth unless the mouth is being held open like you see with the oral airway, or if they're crying. And so what happens is they actually often will continue to cry because they close their mouth. It makes them not be able to breathe. They can't breathe, so they cry. And you can do that for a while, but you know that's hours. It's not days. I was telling your significant other that, or spouse, that we actually had this in a newborn last week. And what we did with that child is use a mouth guard like this for about 6 or 7 days, so for about a week. And the goal of that is to try to let all of the other fluid changes that happen right around delivery, we try not to operate in that first 3 or 4 days if we don't have to, just because there's so many other things going on, not so much from us on the outside, but the baby on the inside is deciding how to use their heart instead of mom's circulation. In your situation, we're going to have to understand the heart better before I can. The other child that I was referring to didn't have any other cardiac or other issues, and so if the cardiology folks tell me no, you need to wait a little bit longer, then of course we would respect that. But once we're given permission, it's usually something that we can do with an operation. It takes about 3 hours. It is something that we do through the nose. Historically, we used to do it through the mouth, where we would actually do a kind of a cleft palate operation, where we would reach that up and see where that area of the bone was and use a drill. Now we're able to get that drill some of the time through the nose, but most of those instruments are designed for 4-year-olds, not for 4-day-olds. So there are times that we do go back to the older techniques to be able to get to that same space. Our goal would be able to give you an airway that lasts at least 4 months. I can't tell you that area won't scar back down, because that's what the body does. If you have a raw surface that's in a circle, the natural action is for it to come on in like this. And so we were very pleased with the patient from last week that we decided not to put in a little stent, a little plastic tube. But we sometimes will do that just as a way of keeping the holes open for the first 3 or 4 weeks, and then we take the stent out. So that's one of those decisions that we have to make in the operating room. The other challenge is the bone in that area is very soft, not so much right at the plates themselves, but out to the edges where we're trying to make the hole bigger. It's very soft. It's that marrow-producing bone, and so it oozes. And so sometimes we'll have a blood loss of 2 ounces. Well, 2 ounces in a 4-year-old is nothing. 2 ounces in a baby this big, you could end up needing a blood transfusion as part of the procedure. Now, babies get more blood transfusions than anyone else in the hospital, and anyone, I mean, it's just part of being a neonate is that we sometimes have to do that just because we know that that we can't run them dry. They have to have a higher preload there. So, and that's another thing that the discussion with the cardiologist will be just what level, where do we want that blood count to be? And so, whereas in my last patient, the patient from the week before, we didn't need to supplement with blood, it may be a little more likely in a patient who has other reasons that they might be exposed to blood. Other than that, it's a very fixable problem in the short term and a very fixable problem in the long term. There are other things that will, as we're exploring, so your child's going to end up getting a CT scan as part of this process, and we'll actually try to make that, and that's one of the other reasons that to be able to get the head shape to kind of move back to where it's supposed to be, because we actually will make measurements in the operating room with a CT scan up in front of us, and we can touch various parts and know where we are. And so that makes the surgery a bit safer when it's possible, because then we can, when we're touching the back of the nose, we know right where the blockage is and what's next to it and how wide you can go and that kind of stuff. But in the first couple of days after delivery, the baby's head shape is going to change, right? It got all switched forward like this, now it's going to come back out like that. And so we would want to get that scan relatively close to the time that we would want to consider surgery so that we don't have to accommodate the shift in the head shape. Okay.
Did you say both sides are blocked on him?
Yeah.
Okay.
Yeah. Now, we were trying to get as good a suction as we could there, and could there be a pinpoint? Yes, there could be a pinpoint, but not a meaningfully big enough airway that we wouldn't have to do anything. Now, I would love nothing better than go and be asleep and be able to push around some things and be able to just stretch that area rather than having to remove stuff. That sometimes happens, but from a practical standpoint, we get such a better look in the operating room than we're going to here that it's not something we have to make a decision as to how we would manage that. But I think that's unlikely. If we did find that there was one side that we could stretch, even if we could stretch one side, we might choose to stop at that. Part of this survey is looking for other issues and trying to decide if there's other things.
What comes first?
Yeah. And this is something that a breathing tube could resolve. And so if your child needed a breathing tube for their heart reasons or those kind of things, then that would be a good choice. If not, then the mouth guard is actually surprisingly well accepted. And though it doesn't look very elegant, it's, at least from the standpoint of the level of consciousness and interaction with you and those kind of things, you may be able to get more with this thing in, even though it looks weird, than with the breathing tube in.